We will begin. Welcome, everybody. My name's Bill Van Gorder. I'm the past chair of the CARP Nova Scotia chapter and the host of these webinars. Today, we have Laura Lundquist with us. Laura is from Zoomer Physiotherapy and Fitness. She'll tell you more about that later on. The topic today is using exercise to manage the symptoms of hip and knee osteoarthritis. So thank you very much for attending. One reminder at this point, and that is that we do record these webinars, so it will be available to you. We'll send all of you the link to it as soon as it's up. It takes probably after the weekend to get it up because they have to be edited and all kinds of fancy things that I've learned to do in a kicking and screaming kind of way as a senior, but I'll have them edited and send that all out to everybody who is registered. We invite you to look at it and to share it with any friends and neighbors. CARP is happy to bring you these webinars. CARP Nova Scotia is a membership organization with a very expensive membership of $15 a year. If you are not a CARP member and would like to support us, please go to our website, carpnovascotia.ca, click on the link to join CARP, and you can support so we will have even more of these webinars. So enough for me, and now over to Laura Lundquist.
Perfect. Thank you so much, Bill. Again, my name is Laura Lundquist. I am a physiotherapist, and I'll tell you a little bit more about me as we get going here. But I am thrilled today to be here to talk to you about managing hip and knee osteoarthritis. And again, because I'm sort of a one-woman show here, handling things on my end, if you've got questions that come up as we go through the presentation, by all means, pop them into the chat. And I probably won't answer them as we're going through, unless it's a moment that I've sort of opened up the floor for you to share your thoughts. But once we get to the end of the presentation, I open up for Q&A. I'll go back to that chat and just scroll through and answer any questions that we didn't already get to. So please feel free to just pop your thoughts in there as they hit you so that we don't lose anything along the way, and we'll just take it from there. So I'm going to share my screen here and get this up and rolling for you. There we go. All right. So with any luck at all, everybody's seeing my screen here.
Looks good from here, Laura.
Okay, fantastic. So we are here, hopefully you are here today to talk about managing hip and knee osteoarthritis through exercise and also through education. They're two really important pieces in the management of hip and knee OA, and it's just so crucial that we get this information out to people. So I was thrilled that we had big uptake from CARP members to join and learn a little bit from me here today, and I really hope you take some valuable information away. And on that thought, what I would love, I have my own goals for today, my own goals for you, but I would love you to share with me what your goals are. So can you just quickly in the chat, just type in for me something that you're hoping to learn today? And then I will do my best to make sure we cover those bases. So just pop something in the chat there and I'll watch for them to come through. Whoop. Oh, there are my goals for today. Hopefully you couldn't read that fast. Yes, mobility with the knees, specifically pain management. Absolutely. Anything else out there? What do we got? I want to enjoy comfort in my hips and knees, learning the best exercises for the knees, exercise specific to knee arthritis, exercises for hip pain. Wonderful. Lots of exercise, so that's good. How to live with knee and hip osteoarthritis without surgery. To know about advances in rehab and OA for the knees, nutrition to keep me going. So that's wonderful. We've got Emily Duvar here today, who is a dietitian with us here at Zoomers. Whoop, hold on. Sorry, I've got somebody now. This also happened last time. I'm going to stop the share just for a second. I'm going to open back up. I think somebody's writing with their pen on their screen, and that actually shows up on our screen for everybody to see. So, so if you sorry. That's okay. Just type in the chat just so that it doesn't show up on our screen. Okay, it must be new technology. It's only happened to me twice, but it has happened to me twice in the last week.
Yeah.
No worries. Thank you. All right. So managing knee stiffness, how to be proactive. Fantastic. Wonderful. Okay. These are all great ideas. And they really fit with what I'm hoping that you walk away with. So My goals are that also you have a better understanding of the pathology of osteoarthritis. So some of you may be arriving today with a pretty good understanding of what's happening inside the joint, but we're going to spend a bit of time reviewing because it's important to understand that so that you can understand how different management strategies are effective. I also hope that you go away with an increased awareness of the impact that physical activity and exercise can have on your joint health. So how activity and exercise can actually improve your joint health, how there are different self-management tools that are available to you and how you can make use of those tools to optimize how you feel and your quality of life, managing that pain, managing that stiffness, and that you really feel empowered and inspired to get started. Right? It is never too early to start managing hip and knee osteoarthritis. And the key is just making sure that you get started sooner rather than later. So as a quick little snapshot of me, again, I am a physiotherapist and have been since 2003. Okay, there we go. All right. So again, our goals are going to be this better understanding of osteoarthritis. We are going to make sure that we've got an increased awareness of the impact that physical activity and exercise can have on joint health, and improving the knowledge of self-management tools. So what's out there for you to really best manage your symptoms so that you can live an optimal quality of life, and then feeling empowered and inspired to get started. Again, a little bit of background on me. So my name is Laura Lundquist. I'm a physiotherapist and have been since 2003. I have my advanced manual therapy diploma, which is hands-on physiotherapy treatment, and a sport diploma. So I've worked with athletes and people who are active at all ages and stages of life. I have really throughout my career had a really strong focus in exercise and the effectiveness of active rehabilitation programs. So really taking an exercise as medicine approach to the kind of care that I have provided for my clients. And that is what inspired me to open Zoomers Physiotherapy and Health Solutions in 2018, where we really focus on the health and fitness of adults over the age of 50. And because of that, we know that arthritis tends to become a bigger problem for us as we get older. And so it has become a big part of my practice to be able to manage it well. And we were the first clinic in Nova Scotia to offer the GLAD program for hip and knee osteoarthritis specifically. And I'm going to talk a little bit more about that program at the end and how accessible it is across the country if you've not already had some exposure to it. So our roadmap in order to get to that, to those goals, in order to achieve those goals today, is to talk a little bit about the pathology of osteoarthritis itself, what's actually happening inside the joint, to recognize the potential impact of osteoarthritis on our quality of life. It's not just about having a painful joint. It has a lot of far-reaching, potentially complications and impacts. Then we're going to talk about the different management options that are available for hip and knee OA, and then spend a specific amount of time or the bulk of our time talking about exercise for hip and knee OA, as well as different self-management tools that you can make use of, including nutrition. And I mentioned at the outset there, we've got Emily Duvar, who's the registered dietitian who works with us here at Zoomers, who is going to share a few slides about different ways that you can use nutrition to help manage your OA symptoms as well. So as we dive into the pathology of osteoarthritis and what's actually happening in the joint, it's important to recognize that this is a situation that affects the whole knee or the whole hip. So it affects the whole joint. And we used to talk about it as wear and tear, or some of you may have heard the words it's bone on bone, or that the joint is just sort of worn out. And what we know now is that, number one, it's not an accurate reflection of what's actually happening in the joint. And number two, when we use words and language like that, it tends to make us feel like we've used it too much and we should stop using it. And in fact, what you're going to come to learn today is that using it is the very way that we help optimize its health when we do have osteoarthritis. So rather than thinking about it as this wear and tear situation, what's important to recognize is that it's actually a mismatch in terms of the rate that the cartilage in the joint is building itself up and breaking itself down. So that cartilage is always in a process of turning over to be healthier. So it builds itself up and breaks down, builds up, breaks down, and that's how it stays healthy. And what we see in osteoarthritis is that that cartilage that lines the ends of the bones starts to degrade or break down faster than it can build up. And as a result of that, we see that the cartilage thins. And as that cartilage thins, then we lose the lubricating value and the shock absorption value of that cartilage, and we start getting more friction. We start to get more instability in the joint, or if it behaves sort of loosely. And as a result of those changes, we see that there is pain with use, in particular in the hip and knee, pain with weight-bearing use. So when we're up on our feet and we're putting that body weight through the joint, we tend to have pain. And as a result of that, we see muscles become weaker. We see that people naturally do less, right? And so muscles become weaker for that reasons. And then we get changes in the way our bodies move and in our biomechanics. And that can then cause there to be a further progression of that osteoarthritic change. So at the joint level, we've got this mismatch of cartilage. There are a number of different structures that are being impacted, but at the end of the day, we end up with pain with weight bearing and physical activity of that joint, which results in muscle weakness, which results in more problems. So you can see how it can go around and around. And the potential impact of osteoarthritis on quality of life is really big, right? So if we have pain and stiffness and that feeling of instability in a joint, then we tend to have decreased confidence in that limb's ability to take us through life and probably to do the things that we enjoy. And so regularly we'll see that people start pulling away from activities that they enjoy. Maybe it's golf, maybe it's tennis, maybe it's pickleball, maybe it's going out for a walk, maybe it's keeping up with your grandchildren at the playground and feeling comfortable to get down to the ground and get back up with them, even in your living room, right? And so, so that loss of confidence in your physical ability can really have an impact on your quality of life. Sleep disruption is also huge. So we typically see with osteoarthritis, as you sort of move towards a more advanced phase of osteoarthritis in the hip and knee, sleep disturbance can be a really big problem with pain at night. And limping can also make previously enjoyable activities too painful or too tiring to continue, right? So if we're not sleeping well, if it feels like we're just sort of lugging a limb along with us as we're out there moving around, sometimes it just feels like doing those activities is no longer worth it because it's too tiring and it's too sore. And as a result of those kinds of impacts of osteoarthritis, we can have whole health impact. So from a physical health perspective, there can be implications for blood pressure, for our body weight. We can have increased risk of diabetes and cardiovascular disease. We can also see impacts on our mental health and our emotional health. If we're no longer participating in those activities that give us joy, then we start to feel, and we are really missing out on the things that we love doing. And that can have a real impact on our mental and emotional well-being. So it's important to recognize why we need to manage hip and knee OA well, because we want to prevent these things as best as we can in order to live a fulfilled life. So when we look at management options for OA, we really divide them into 3 different lines of treatment or tiers of treatment. And the first line of treatment, which we know through the research is absolutely appropriate for everyone at every stage of hip and knee osteoarthritis, which is exercise, the appropriate exercise, education. So you're on the right track by being here with me today and starting to get a little bit more knowledgeable about osteoarthritis, and then weight management. We know that those 3 things are important for everyone with hip and knee OA. We also know that sometimes exercise education and weight management isn't enough to get sufficient control of symptoms. And when that's the case, then we go to the second line of treatment. And so that second line of treatment can involve things like medications, passive therapies, like maybe coming to a physiotherapy or massage therapist, maybe bracing, maybe using a gait aid like walking poles or cane, those sorts of things. And then, and also important to recognize that sometimes we move back and forth between the first and second line of treatment. And I'm going to talk about that a little bit more as we dive deeper into those 2. The third line of treatment, which there is no coming back from, obviously, is surgery. So, so surgery, and here we would be talking about partial or total joint replacement surgery, is obviously an option for people with hip and knee OA. But Importantly, it's only about 3 to 5% of people who actually require surgery. So it really is a small percentage of people that end up going down or requiring that level of management. And so again, it's important to try to make use of all of the other options that we have available to us as best as we can. Exercising. So we're going to hop in here. Exercising to help manage osteoarthritis. Well, how does it help? Remember, I talked about the cartilage and that turnover, right? That it's building itself up and breaking down, and that cycle becomes mismatched and it breaks down more than it builds up. What we know about whatever cartilage is remaining in the joint is that it requires loading and unloading in order to be maximally healthy. So the cartilage itself doesn't have its own blood supply, which means in order to be nourished and fed, it needs to be able to suck in the fluid from the joint in a different way. And the way that it does that is by having these little molecules within its structure that act like sponges. And when you squish down on them, they squish the fluid out. And when you take that pressure off, they suck all the fluid up into the tissue. And so when we have loading and unloading that we get with something, say like going for a walk, where the foot is on the ground, off the ground, on the ground, off the ground, we know that those sponges are sucking the fluid in and pushing it out in order to maximize the health of the cartilage. So exercising can actually increase the health of the cartilage that's existing in the knee. We also know that exercise can help increase muscle strength, right? So we can certainly make muscles stronger through exercise. And in doing that, and if we do it in this, what I'm going to say is sort of the right way, which is thinking about our body position as we go, we can actually create better joint alignment. And that's really important in hip and knee OA in particular, because if there's one part of the joint that's affected by those changes, if we can make the muscles control the limb a little bit better to redistribute the pressure in the joint, we can often take the pressure off the painful part of the joint and make movement feel much better and allow us to be more physically active. We also know that exercising can be helpful from a body weight perspective. So obviously the less weight that we're carrying with us, the less weight we have pushing down on our joints. So that can be helpful from a pain relief perspective. And we also know that the less fat cells we have in our body, the less systemic inflammation we have. And so that can be also a nice side effect of being physically active, which is less to do with your body weight and more to do with the volume of physical activity that you're doing. So what type of exercise is best? If we're in agreement that exercise is a good idea, what type? Well, really all of them. So we need some aerobic exercise for our whole physical health. It helps with the weight management piece. It helps with that loading and unloading. So examples of aerobic exercise would be something like walking, cycling, swimming to a certain extent, but we're not getting the same loading or pressure on the joint. The elliptical machine can be a good one. So those kinds of activities where you're just sort of repeating the same movement over and over again and your heart rate is coming up would be good examples of aerobic exercise. And we would want to be doing that. The Canadian guidelines would tell us trying to get at least, the overall Canadian guidelines are at least 2.5 hours a week. And that can be in chunks as small as 10 minutes. It has been suggested also that for those with hip and knee osteoarthritis, even aiming at least in the short term to get as much as 45 minutes in a week is a good starter goal. And then once you've got that, then try to work from there to get up to the 2.5 hours per week. Then I'm going to go to the bottom bullet there of flexibility and mobility. So again, we want to make sure that the muscles aren't unduly tight, which would apply more pressure to that joint. And a joint with osteoarthritis doesn't like being under pressure for a sustained amount of time. So we want to make sure that the joint is as flexible as it can be and that the muscles in the area are also as flexible as they can be so that we're not getting excessive pressure on the joint, and also to allow us to move in an optimal alignment or position. When we end up with muscles that are quite tight, they can pull us out of an optimal alignment, and then we can get, again, excessive pressure in any one part of the joint that can cause more pain. The other piece is strengthening. And so I touched on this a little bit already, but from a strengthening perspective, making sure that we're thinking not just about making the muscles stronger, but also teaching them how to do the work in the way that we want our body to move in our day-to-day life. So one of the exercises that I love the most for this, at least as a starter, especially for hip and knee OA, is just practicing a sit to stand exercise. So going from sitting to standing and then back down to sitting. But as we're doing that, really focusing and thinking about the alignment and position, keeping the center of our foot aligned with the center of our knee, aligned with the center of the hip as we go up and as we go down. Often see with hip and knee OA that the knees tend to knock in towards each other. And when that happens, again, we're getting excessive pressure inside the joint. If we strengthen those muscles in the area and make them stronger, we have to also teach them, reteach them how to align our body optimally. And so that's that neuromuscular piece of strengthening. This is my favorite physioism. If you've heard me talk before, you've probably heard me say it. Motion is lotion. And that really is, for our joints, all about that cartilage, right? So again, when we're moving and we're getting that loading and unloading, that fluid is sloshing around in and out of the tissues, improving the health of everything in the joint. And that's what will make that joint, again, have optimal health and hopefully have optimal comfort. All right, and now I'm going to throw it over to Emily, and she's going to talk a little bit about adding nutrition in here. She's got a couple slides here. So Emily, I will just advance them when you ask me to, but otherwise you can take it away.
Sounds great. So for nutrition in terms of osteoarthritis, there's no specific diet per se that you need to follow. Kind of on the point that Laura mentioned earlier, in terms of weight can influence systemic inflammation in the body. That's really would just be your ultimate goal in terms of how nutrition can influence this. So there are inflammatory foods, there are anti-inflammatory foods, which is mostly what we're going to cover, and how those foods contribute to either inflammation or help prevent inflammation. So you can switch to the next one. First, the inflammatory foods. So the categories that kind of exist are added sugar and refined carbs, fried foods, red and processed meat, margarine, shortening, and lard. So for added sugar and refined carbs, both of which, added sugar being sugar that's just added to food, primarily prepackaged types of food. Refined carbs are carbohydrates that have been kind of stripped of a lot of the grain. So they are mostly sugar, or we just digest them very quickly. They cause spikes in blood sugar. So like your white bread, white flour, those types of things. A lot of like packaged foods are also usually refined carbs, like crackers can often be refined carbs, those types of things. So when you eat a lot of sugar on its own like that, it'll spike your blood sugar. When you have an excessive amount of sugar in the blood, that insulin that your body would release can't take it up. It'll just trigger inflammation to occur. So avoiding that would be a good way to go about doing it. So an easy way would just be incorporating more whole grains into your diet would be how you avoid these things, and eating them in moderation when you choose to have them. In terms of fried foods, the reason they can often contribute to inflammation is that foods that are deep fried are typically fried in oils like peanut oil, canola oil. They're really high in omega-6. And most people, I'm sure, are aware of omega-6, omega-3s. We talk about them a lot. They exist in the body in a ratio, so they have to stay balanced. And we exist in a world where our diets are usually really high in omega-6s on their own. Omega-6s are just more common in a lot of like fruits and vegetables. They're a lot easier to eat, whereas omega-3s do not exist in a lot of foods. They're a lot harder to get, which throws off the ratio. So when you eat a lot of fried foods that are inherently high in omega-6, it'll throw off your ratio, and that on its own will prompt inflammation because your fat in the body is just a little wonky, and your liver doesn't really like that. In terms of, actually, the other two are also to do with fat. So fat being wonky in the body, you don't like. So for red and processed meats, the issue with those ones is just the saturated fat. Unfortunately, we don't actually know the reason why high saturated fat causes inflammation. We just know that it does. The research is there to support diets that are high in saturated fat causing or being negatively impacting things like diabetes, cardiovascular diseases. It negatively impacts things like hypertension, which are high inflammatory conditions. In a similar vein, margarine, shortening, and lard are also high in trans fat. And trans fats, again, are really not very good for you. They've been shown to help contribute to, they raise your bad cholesterol, they'll lower your good cholesterol. They've been shown to contribute to things, again, like type 2 diabetes and heart disease. But we're not 100% sure why, like what the pathway is of having your fat intake in the body, how exactly that does contribute to, or what the mechanism that's causing the inflammation. It just causes the inflammation. So that's not a super satisfying answer, unfortunately, but those are the foods that generally we want to limit our intake of. And then next are the foods that we would like to try and increase in our diet. So these are the main things, nutrients, that are really beneficial, that really help with inflammation. So first one being antioxidants. An antioxidant, primarily they're found in fruits and vegetables. They're also found often in a lot of tea, specifically like green tea and stuff like that. Antioxidants, kind of like the name suggests, they help fight oxidative stress. So oxidative stress, meaning oxygen floating around in the body. Often referred to as free radicals is usually how most people know what that means. But a free radical is just kind of like a oxygen molecule essentially floating around in the body. It's unstable. It'll attach to anything that it wants to. Could potentially be your cells. Your cells don't like when things just willy-nilly attach to them. And it damages them in the long run. So high levels of free radical, high states of oxidative stress causes inflammation. Eating a diet that's rich in antioxidants is a great way to help prevent that. Some different types of antioxidants that exist are things like vitamin C, vitamin B, beta carotene, or the orange pigment in fruits and vegetables like carrots, and zinc, which is a mineral. So antioxidants are super high in fruits and vegetables. Eating enough fruits and vegetables in the diet is a great way to get all the antioxidants and a nice comprehensive profile of the antioxidants that you do want to eat. The next one is fiber. So to refer back to the added sugar and refined carbs, fiber does the exact opposite of that. It helps stabilize blood sugar levels. So when you eat it, so when you're eating carbs that are complex carbs, therefore not refined carbs, they have fiber in them, which is how they help stabilize the blood sugar. They slow down the absorption of sugar from your digestive system into the bloodstream. And that effect of slowing down the blood sugar absorption and not having a blood sugar spike helps prevent within itself inflammation. Omega-3, to go back to the fat one, increasing your intake of omega-3 is a great way to balance your ratio back out. Omega-3s are very, like I said, hard to get in the diet. So some great sources to incorporate are fatty fishes, your salmon, tuna, trout, mackerel are all really good fatty fishes. Nuts and seeds like walnuts and almonds, seeds like chia seeds, flaxseed meal, that type of thing, all really high in omega-3s. You can also buy supplements for omega-3 that are really great to use. A general rule of thumb for me would be increasing your omega-3 intake rather than reducing your omega-6 intake is usually a lot easier for most people. But omega-3s are really great. They really balance like your fat profiles in the body. They lower your triglyceride levels. They lower your bad cholesterol. They raise your good cholesterol. And they help remove plaque from your arteries, or that's what omega-3s do. So plaque is just like fatty deposits that build up like within the circulatory system. The last category is polyphenols. These are different types of plant compounds. Mostly they're pigments in fruits and vegetables. So the things that exist in plants that cause them to be whatever color that they are. different pigments, different names. Those are polyphenols. They're really good for you. They've been shown to help reduce inflammation. We're not 100% sure why or how they do it. We just know that it does. Could also be simply just the fact that fruits and vegetables are high in antioxidants. They're high in fiber. They're also high in polyphenols. Could be the whole shebang of all of them contributing to help with lowering inflammation overall. But they've been shown to be good for you. We have a couple of specific studies on them. So they are really good for you. So any of your very colorful vegetables, any of your colorful fruits, amazing, great. We love to see it. Love to see the nice rainbow. Dietitians love to talk about the rainbow. So incorporating all of your different colors in, you'll get all the different types of polyphenols, is a really good way to go about it. A general way to rephrase a lot of this information is simply, this is a lot of just like general healthy eating guidelines that I've put in the context of inflammation because it is relevant for osteoarthritis. Inflammation plays a really big impact in this, but a lot of these tips are very much like increase your fiber intake. Most dietitians are going to tell you that. Increasing your fruit and vegetable take. We say that all the time. It's a lot of like general healthy eating stuff. So if putting it in that context makes it easier for you to absorb the information and make the changes, I would encourage that as well.
Awesome. Yeah. Thank you, Emily. And do you know what? I have listened to dietitians talk a lot. I know a lot about osteoarthritis, but I feel like I just had a little aha moment myself, which is, and it's an easy way I think to think about it, is the inflammatory response is our body's response to threat, right? It's our body's response to something is wrong. And so if through what we're doing physically with our bodies or what we're putting into our bodies, we are creating a scenario that is making it difficult for one of our systems to function well, that is going to trigger inflammation, right? Yeah. And so, you know, finally, I just put it all together. So I feel like I agree with you, just that you're summarizing comments there, that if you just think of it as the importance of healthy eating in the context of inflammation and osteoarthritis, is that you want to feed the body things that it wants to receive so that it's not fighting what you're giving it. Because if it's fighting what you're giving it, it's going to increase your inflammation in your system. And then we know if your systemic inflammation is up, we know that that has a negative impact even for a local joint problem like osteoarthritis. Awesome. Yeah. Thank you. Emily, are you able to stay on with us so that people can ask their questions at the end?
Absolutely.
Amazing. All right. I'm going to move us out of nutrition and into the next part of our second line of treatment here. But again, we'll have lots of time at the end for Q&A, so we'll come back to that. I can see that there's already a couple questions in there. Love it. Keep them coming. So into our second line of treatment, nutrition would be one of those things, although I would say really that kind of goes with weight management. I might even, you were my bridge between first and second line treatment. So then the other second line treatment things are going to be tools like, number one, learning appropriate pain behavior interpretation. Now, let that sink in for a minute. What that means is that you can understand what your body is telling you, what your pain signals are telling you, because we know in osteoarthritis, pain is not a good representation. It is not telling us about tissue damage. It's way more complex than that. And so what's important is to be able to understand what that joint is telling you after a certain activity or during an activity, and then be able to adjust your choice of activity, intensity, duration, frequency, whatever it is, so that you can continue hopefully to do it, but in a way that is reasonably comfortable to you and that you feel confident with, and with the understanding that you're not worsening your situation. One of my favorite facts about hip and knee osteoarthritis is that you do not get more arthritis by being physically active. I'm going to say that one more time. You do not get more arthritis by being moderately, we'll say, physically active. If you decide to run 5 marathons a year, maybe we have a talk. Other than that, you do not get more arthritis by being physically active. So we have to know how to interpret those pain signals and then be able to continue on with the things that we want to do, whether that's through pacing, like I was just talking about, maybe bracing. So specifically when we talk about knee osteoarthritis, there are a lot of great braces out there. I understand that there are some out there for the hip, although frankly, I have not ever had anybody have one or really seen any that I thought were particularly beneficial for my clients. But that's not to say that there might not be something out there. But knee bracing wise, there are lots of both off-the-shelf options and custom bracing options. And really, it's important to work with your healthcare provider to make sure that you get the one that's right for you. When it comes to knee osteoarthritis, there are 3 different compartments of the knee that can be affected. So depending on which part of the knee is affected for you and how that's impacting the things that you want to be able to do, that will help drive what kind of brace is most helpful. I would say generally, people often find that the custom braces are most effective and comfortable in the sense that they fit the best, they slide the least, and maybe have a little bit more power to what they can do for you. But they can be quite expensive, somewhere in the neighborhood of $2,000 to $3,000. And then there are lots of off-the-shelf options that are going to run you more in the maybe $150 to $800 range that can also be effective depending on what your needs are. So it's really important to work with a healthcare provider to make sure that you get connected with the right brace for you. Gait aids are another wonderful thing with hip and knee OA. Obviously, a cane might be something that comes to mind, and sometimes we could get to a scenario where we needed to use a walker or rollator walker. But one of the ones that I think of the most are walking poles, and 2 different kinds of walking poles that we use regularly here. So the Nordic walking poles can be a wonderful way to increase the amount of muscle use you're getting, really increase the fitness demand of your walk, and provide some stability as you're going. And that can be really helpful if you've got a joint that feels a little bit unstable, feels a little bit unpredictable or unreliable. There's also another kind of poles called activators. Those poles are designed to offload the joint a little bit more and provide a little bit more stability in the way that you use them. So both can be a great tool in allowing you maybe to be able to walk for 40 minutes instead of being able to walk for 20 minutes, right? So it's all about choosing tools that help enable you to be more physically active, to do the things you want to do. Another question I regularly get is hot and cold use. When should I use hot? When should I use cold? So going back to our conversation about inflammation, when we've overdone perhaps activity or something, or sometimes we just don't even know, or we've had an oh no moment, you turned and had some sharp pain in your joint. Any of those times I would consider there to be inflammation. Inflammation has the word flame in it, which sounds hot. I would generally not put anything hot on top of something that is already hot. So if you have that sense that there is an acute situation, something is very sore, then I would put on ice. I usually recommend 10 or 15 minutes, 2 or 3 times a day, and see if that's helpful from a pain management perspective. That's all we're looking for there is pain management. Hot, I find, or using a heating pad can be particularly helpful if you just have a stiff, sore joint. It's not particularly acute, nothing significant has happened. It's just kind of stiff and sore and achy. Sometimes people will find that heat is helpful. Again, I would suggest 10, 15 minutes at a time and on an as needed basis. And again, just with the goal of it providing a little bit of pain relief. Lots of information out there about hip and knee OA and medications. As a physio, suggesting medication for people would be outside my scope of practice, but the research out there tells us that the topical anti-inflammatory, so this would be like Voltaren is the off-the-shelf version or the over-the-counter version, and then diclofenac is often the one that is prescribed by physicians. And it's just like a cream that you rub on the joint and can be quite helpful in sometimes delivering some pain relief and an anti-inflammatory directly to that location. So that's one kind of topical medication you can use. There's another type of topical cream you can use that it just creates a sensory distraction. So the one that we use a lot here is called BioFreeze, but there are a lot of different ones on the market these days. And the way that those ones work is that, you know how if you hit your knee on the coffee table, the first thing you want to do is rub your knee. And for as long as you're rubbing your knee doesn't seem to hurt quite so much. But then as soon as you stop rubbing your knee, then it hurts again. And that's because the feeling of rubbing travels faster than the feeling of pain. And the way our brain works is whichever signal makes it to the spinal cord first wins the race, and that's what you'll feel. So when we use one of these creams that is one of those sort of like icy hot patches or one of the creams that go on, that's all that's happening is that it's distracting the nerves from the pain and just giving you the signal of that feeling. And so those can be really helpful, again, just from a comfort perspective, so that you can carry on doing the things that you want to do. There are also oral medications that certainly lots of people make use of in the management of their hip and knee OA. The research tells us that Tylenol or acetaminophen is really not effective for pain relief in osteoarthritis, which is often comes as a surprise to a lot of people. In the research, the anti-inflammatories would be what are recommended, which would be like Advil, ibuprofen, Aleve, naproxen, Celebrex, meloxicam, diclofenac, the oral version. However, those non-steroidal anti-inflammatory drugs, or NSAIDs for short, do have potential consequences from a GI perspective and a blood pressure perspective. So taking those medications really needs to be something that you do in conjunction with your physician or nurse practitioner or pharmacist to make sure that it's right for your whole health picture. We can't just think about the osteoarthritis, we have to think about the whole health. All right. Anybody feeling overwhelmed with all that information? I can't see all your faces, but I'm imagining there's a few nods out there. So figuring all of this out for yourself can be really hard, right? There's a lot of moving pieces to figure out. And so the great thing is, I mean, that's why there are people like me and like Emily around who are here to be your partner in a journey like this. But also there are some great programs. And the one that I want to highlight today is the GLAD program. And I love highlighting this program because it's a national program. So it stands for Good Life with Osteoarthritis from Denmark, because it was developed in Denmark by a physiotherapy researcher there. And it's a 6-week exercise and education program specifically for people with hip and knee OA. So it is only for the management of hip and knee OA. That's not to say you might not also have some other health condition or osteoarthritis in a different body part as well. But the reason to take this program would be that you have hip or knee osteoarthritis that requires better management. Or that you're newly diagnosed and you want to optimally manage it to try to prevent disease progression as best we can. It's an evidence-informed program, so they've looked at the research to identify what are the key aspects in helping people best manage hip and knee OA, and that's how they develop this program. And the goal is really to help people better self-manage their symptoms for the long haul. So it's the 6-week, twice-a-week exercise and education program. But then once you're finished it, the idea is that it has given you the tools that you need and the knowledge that you need about exercise and movement to be able to stay strong, keep moving, do the things that you want to do, and keep your symptoms in check. So these exercises here are an example of things that we might do in the GLAD program. So there are, we certainly make use of exercise bands when we do it. We do functional movements like getting up and down out of a chair and practicing going up and down a stair. All again, thinking about alignment and position so that we're optimizing the health of the joint. We also practice these different sliding techniques where it prepares us, for things like lunging down to pick something up off the floor, getting up and down off the floor, those kinds of activities. It also includes a warm up and a cool down. So we're getting that bit of aerobic component and some flexibility and mobility as well. And so when people participate in this GLAD program, again, like I say, it started in Denmark in 2013. It was so popular that the Canadian Orthopedic Foundation, which is like the professional association of orthopedic surgeons in Canada, we were the first country, actually, Canada was the first country to license to offer the program outside of Denmark. And so it came to Canada in 2016. And like I said, at the very beginning, we were the first clinic in Nova Scotia here to offer it in 2018, but now it's available across the country. So there are GLAD certified clinicians across the country. To my knowledge, there isn't anybody who's offering the program in Quebec, but we're working on it. And what we see after people participate in the GLAD program, because we have people fill out surveys before and after, and as well at 12 months after, is that we see people report on average a 30% reduction in their pain intensity. That's pretty big. It's pretty good. And when we get that much reduction in pain intensity, we tend to see less reliance on pain medications. We can also see increase in walking speed for people, in leg strength and power. We do those tests before and after. And then probably one of the biggest one is the reduced fear of damaging the joint. So a lot of times with osteoarthritis, because it's painful to move and we're used to interpreting pain as harmful, therefore we stop moving, which actually makes the problem worse, right? Because then that cartilage doesn't get that loading and unloading. So when we see that people are no longer fearful of damaging the joint, then we see that people are inspired to be active and do more and live a healthier lifestyle. And that, of course, leads people generally to having a higher quality of life or reporting an improved quality of life, which is ultimately the goal of the program. So again, if you have an interest in that GLAD program, like I say, it's just something that's offered nationally. GLADcanada.ca is a website you can go to. There's a locations tab on there, and you can just click on it and see what clinics in your area or what service providers in your area offer it. In some provinces, there can be some options for public funding, but in most provinces, it's something that is just privately. It would just be like going to the physiotherapist, or sometimes it can be a chiropractor, but anybody who's offering the GLAD program has been trained by the GLAD Canada folks in order to, and been certified in order to provide the program. So that brings me to the wrap up, and then we'll take it to the Q&A, and I'll be happy to answer your questions. I am hoping that you feel like you've got a better knowledge of how we can effectively manage the physical and mental health impact of hip and knee OA, and that it's possible. We can do it. We just have to have the right tools at our disposal. It is never too early or too late to start managing your symptoms of hip and knee OA. And remembering that appropriate exercise and self-management strategies are absolutely key in optimizing your success to live a life you love, which is the words that we live by here at Zoomers. And it's totally possible with hip and knee osteoarthritis. Just takes maybe a little bit more work than if you didn't have to manage that as well. So I'm going to stop my share here, and I will bring up the chat. There we go. Perfect. So I'm going to start by just going through the questions here in the chat. So feel free to pop your questions in if you like. If I'm answering your question and you have something you want to follow up, just unmute and pop yourself into the audio, and we'll go from there. All right. So I'm just going through our initial things here, your goals. Hopefully we nailed most of them, and if not, put your question in and we'll try to catch up before we're done. All right, so second line of treatment. Oh, so what is bracing? So I think we got to that sort of later in the presentation. And what does GLAD stand for? So again, that's a Good Life with Osteoarthritis from Denmark. Program. Oh, Emily, it's one for you. Is butter we're into the nutrition questions. Is butter to be avoided?
So this one and the next couple ones, is butter to be avoided? Is olive oil as healthy as advertised? And is avocado oil a good choice? I'm going to just answer them all together. No, you don't need to avoid butter. It's a fine option to eat. I would, depending on how you use butter and how often you use butter, switching it over to one of the other oil options, being olive oil or avocado oil, specifically in terms of cooking, like when you're cooking some veggies or any other type of cooking that you're doing, when you're heating up a pan with oil. If you use butter in that application, switching over to an oil, yeah, I would make that recommendation, just because butter's high in saturated fat. Olive oil and avocado oil are both great options. They're very high in unsaturated fatty acids, which sounds really similar to saturated fats, but unsaturated fats are very good for you, so we want to get them. In terms of, is olive oil or avocado oil better, because that's something I see a lot, I think they're both perfectly fine. I think avocado oil is a great choice. Olive oil is a great choice. Whichever one is easier for you to get is fine to use. The smoke point of avocado oil is higher, so it won't catch fire as easily as olive oil does, or like in terms of that. So if that entices you to use avocado oil, then you can do it. If you like using it, that works for me. Yeah. Excellent.
Thank you. Smoke point important in my kitchen. Okay, what is the main purpose of bracing? So the primary purpose of bracing would be to reduce your symptoms so that you can be more physically active, right? So we want to be able, if it's not possible to walk comfortably because you've got pain in your knee and you can put a brace on and you can walk more comfortably, then that's a good reason to use a brace. You should also be doing the strengthening, right? It doesn't replace doing that, but it can be a great tool in allowing you to be more physically active. If pain and inflammation increases after exercise, should we use cold packs or hot packs? So generally, I would say if after activity you find you have a spike in symptoms that lasts for more than 10 or 15 minutes, then probably using a cold pack is a good idea. For about 10 or 15 minutes to try to settle that joint down. And then I didn't go into it today, but it would be part of that education around symptom management and listening to your body. So when we are physically active, it is normal to have pain in a joint with osteoarthritis when we're exercising. It is to be expected. We wish probably that we didn't have it, but it is normal and it is not harmful as long as we're working within a reasonable level. For most people, that would be, if we thought of a scale of 0 to 10, where 0 is no pain and 10 is call me an ambulance immediately kind of pain. So it's a big scale. Then for most people, usually it's working somewhere around no more than about 4 or a 5 out of 10 in terms of pain intensity during the activity. And then it shouldn't really linger around for a long time after, shouldn't give you a bad night, and no activity hangovers the next day. So if you feel worse for having done whatever it was you did yesterday, it doesn't necessarily mean you can't do that thing. It just might mean that you didn't do it in the right dosage. Maybe you did it for too long. Maybe you did it at too high an intensity. Maybe you weren't in optimal positioning. And again, that's where working with a healthcare provider can be really helpful to just make sure that you're getting those signals correctly and starting to learn from your joint, and then make some adjustments and then try that activity again and see if you have a better response. But if you did an oops, then ice would be what I would usually recommend. Can osteoarthritis be fully cured in young people and not in the elderly? So unfortunately, osteoarthritis is not something that can be cured or reversed. It progresses at different speeds for people. So some people have a very quick progressive osteoarthritis. For most people, it's very slow and may not progress to a significant severity for lots of people, right? Remember, only 3 to 5% of people get to the point of needing a joint replacement. So for many people, it's something that they have to manage, but it isn't something that progresses aggressively. Yes. Is the GLAD program available anywhere in Dartmouth? I believe there are some providers in Dartmouth. Whether or not they're currently providing it in Dartmouth, Nova Scotia, you just have to double check on that tab on the GLAD Canada website, and it should be fairly up to date. And you just call the clinic and ask them when their next session is. The other thing about that program, especially if you're depending on where you're joining from here, is that a lot of clinics have offered, because of COVID, went into an offering of a virtual program. So especially for people who are in a more rural area, sometimes if you don't have access to a clinic that's providing the GLAD program where you are, sometimes you can still access it virtually and join in via Zoom like this. You're already all on Zoom, so you could do it. And the only important thing there is that you have to do it with a provider within your province. So you can't, because it's a healthcare service, you can't cross a provincial border. Can physiotherapists join GLAD Canada if he or she is not registered? So a physio can only offer the GLAD Canada program if they've been certified through GLAD Canada and registered through their GLAD Canada program. Someone has here, so Janet, I try to push through the pain while exercising. Is this harmful, or is it okay that I do this? So that goes back to what I was saying just a moment ago about pain intensity, and then reading how your symptoms behave the night of and morning after. And again, if you're not getting what I would say is like an activity hangover the next day. And what I often also will say to clients is like, if I could happen upon you on the sidewalk and I see you walking and I can tell that your knee is really sore, you've gone too far that day, right? Or you've gone too fast, or whatever it is. So if you're visibly limping or adjusting the way you're moving because of discomfort that you're feeling during activity, then we need to make some other adjustment, because you don't want to be getting into those compensated movement patterns. Oh, it's an omega question. I'm taking omega 369. Should I just be taking 3?
No, I think if you're taking a 369, that's fine. You can continue to do so. That's perfectly acceptable. It just gives you the whole profile of omegas.
Great, thank you. What exercises can we guide someone who's 80 plus? Because we have to think about the fragility of the bones. So again, that's going to be, and I really can't give specific information about anybody, but exercise is safe for everyone. It's just about intensity. I am a big fan of functional movements that somebody's already doing in the day. If you're getting up and down out of a chair multiple times a day, then you can probably do a sit to stand exercise. It might have to be modified from the height that you're working from. If you can do a walk up the flight of stairs, then you can probably do a step up exercise, because those are movements that we know the body is already doing and tolerating well. But again, what's relevant and appropriate for a specific person really needs to be done in consult with their physiotherapist or other healthcare provider. All right, last one here, and then I'll open the floor in case there's anything else. At what level of pain should we know that we should stop exercising? Okay, so we sort of went there because my grandma gets pain and that cracking sound when I ask her to do isometrics, which is just turning on the muscles without moving the joint. So we know that I like to call it joint music, right? But that sort of clicking, cracking, grinding, popping music, we will call it, is a normal part of osteoarthritis. Is not harmful to the joint. When you hear that, you are not rubbing the bones on each other and creating more arthritis, right? So that's not what's happening when you hear those things. But it really is more about pain intensity and position. And again, in terms of which exercise is specifically appropriate for that person. So really needs to be done, again, in consult with a healthcare provider. All right.
Laura, we only have a minute left, unfortunately, but people got lots of questions answered on the chat, and we're going to lose our connection. So I think we have to wrap it up now.
Okay, wonderful. Thank you so much, everybody. Thank you, Emily, for joining us. And thanks for the great questions and participation. Thanks to CARP for having us.
Great. Thank you, everybody, for watching. And when you get the recording, the links to get in touch with Laura and with CARP will be in that information. Thanks for watching.
Motion is lotion.